Hello, so for my second PP2 assessment, I've been given a task to reflect on a scenario whereby a junior doctor is behaving unusually with an alcohol smell in their breath. This doctor is actively reviewing a patient and writing notes in the patient file. So it's actually quite a difficult and sensitive scenario, but the code of professional conduct is very clear. My duty is to protect patient, uphold professional integrity, but at the same time support my colleague with compassion. So first of all, the thing that I will do is to protect patient from harm, and this is one of the most important ethical principle, which is non-maleficence, means do no harm. So what I will do is I will approach my colleague discreetly but firmly ask them to stop doing their clinical duties and ask them to wait in a room, and then I will review the patient as well as the patient note to see if there's any mistake, and if there is no mistake, it's good, but if there is a mistake and it's already done, I will try to rectify the mistakes, and I will also assign a new doctor to the patient to make sure that the patient has a continuation of care. Once the patient is settled, then I will go meet and talk to my colleague privately, and I will try to see what caused them to act that way. Especially for a first timer, it could indicate an underlying problem or struggles, and I will not do it. I will not confront them publicly because they also have their dignities to protect. But as a professional, it is my duty to be transparent and responsible. So I will still have to report these incidents to my superior or my consultant, and at the same time, I will document all the things that I've seen and watched. So everything that I've said so far is basically a short-term management. For long-term solution, what I will do is I will talk to my colleague and try to tell them and encourage them to seek a professional help, such as a counselings or occupational help. And at the same time, I will also try to create an environment whereby a doctor can be freely talk regarding their problems without being judged, so that when we work, we can work in a very nice environment and a stress-free environment. And at the same time, with the documentation that I previously made, it can also be helpful to discuss with the team regarding what to do in the future to prevent such recurrence. So as a conclusion, the ethical principle that I use for this scenario is non-maleficent, do no harm, beneficent, which is act in the best interest of both the patient and my colleague, justice, ensuring that the patient receive a correct treatment, and autonomy, which basically respect the right and the choice of both patient and my colleague. So saying this is actually easier said than done, because the challenge with this kind of scenario is basically to balance our duty as well as compassion, and then the fear of damaging a colleague's career, and also to manage the team dynamics. Despite saying that, what wrong is wrong. We as an adult, we as a doctor need to be responsible of our action, and if we make a mistake, it's okay. We can learn from it. That's about it. Thank you.